My name is Ken Jocelyn, and I'm a member of the Westminster Social Justice Forum Planning Group. And today we have Annie Lee from Wilder, who's going to talk about a bunch of things that I'll mention in a minute. But I wanted to mention that we have a theme every year, and this year's theme is investing in each other's future. And we are hoping that the forums here, for those here in the room and those online, will really help us learn about issues in the community and to ensure that our neighbors thrive, to better understand the structures and systems that have failed, and to explore ways to work together to change outcomes. So we're recognizing, and of course the church has been talking about this, there are systemic, thank you, Eric, that there are systemic problems that we need to deal with. And so that's part of what we're going to learn. For those in the room, as we get to the end, raise your hand and we'll ask questions. Question and answer is always important. And for those online, you can put a question in the chat, and that'll be monitored, and we'll bring that forward. So, let me tell you a little bit about Annie. And my favorite is the last sentence, but she's a research associate at Wilder. And works on something called Compass, among other things. And Compass is one of the most amazing tools that I've ever seen. I've been in healthcare and used Compass. It is a source of data about anything and everything that goes on in our state. And it has comparative information from other states. And it's things like healthcare. Who really has what kinds of healthcare? What are the struggles that go on? And they analyze data that's used by politicians and all kinds of people. They're kind of the go-to source. Her own particular work is in the social science research projects. She has a background in public health with interest in housing and DEI, which is diversity, equity, and inclusion, if I've got that right. And she really is there because she enjoys working with organizations to help them better the community through the use of real data. She's from Wisconsin, but been here for 5 years and considers this her second home. And she enjoys Minnesota summers, we all do. But this I loved, and year-round cribbage tournaments. So with that, I'm going to let you take it away.
Wonderful. Thank you, Ken. Can everyone hear me okay? Wonderful. Well, again, my name is Annie Lee. I'm a research associate at Wilder Research, specifically on the Minnesota Compass Project, and that's what I'm here to talk to you all today. We're going to talk about our community, what data on our community or our changing demographics look like. Wonderful. All right, so here's the agenda for today. I have an icebreaker question that people in the room can engage in. People online can also participate in, and maybe we can get some feedback from that. I'm going to provide an overview of Minnesota Compass, and then I'm going to get into statewide and metro, the Twin Cities area, data around housing, employment, healthcare, and some community engagement work. And then I'm going to do a little tutorial on Minnesota Compass's live website. We have our Build Your Own Profile tool. And then we have some additional resources and then some questions for discussion at the end. Hello, everyone. All right, how does that sound today? Any questions before we begin? Great, well, we'll go ahead and get started. So this icebreaker question that I have for you all today is, what is the largest share of our population right now? Is it young children, 0 to 4, school-age children, 5 to 17, working age adults, 18 to 64, or is it older adults, 65 and plus? 65 and older. Working age adults, 1 and 1. Other thoughts? Working age adults. All right. For those participating online as well, I don't know if anyone has any response. All right, thank you. All right, so we got some working age adults, older adults. Does anyone think it's school age children or young children right now? All right. So the answer is working age adults, primarily just because it is the largest age group here. But The second largest share of our population is school age, older adults. Second largest share of our population currently is school age children 5 to 17, but not for long. So we're here in 2021 here, and this pink line represents the school age children 5 to 17, but will soon be surpassed by those who are 65 and plus. So as you can see, the working age adult population is going to continue to increase over time, and then we're right at this crux of where older adults will soon be the second largest share of the population in Minnesota. So that's what we're going to talk a little bit about today. And then I just want to hop back into what Minnesota Compass is all about. So we are a social indicators project, meaning that we look at a number of indicators for the state of Minnesota for quality of life. We do this to build strong communities. We try to understand the trends and then also plan for them. We make sure that we have representation from all parts of the state. And so while there's a lot of great detail and data around the Twin Cities Metro, we want to make sure that that's not that doesn't represent all of Minnesota, right? And so there's a lot of great stories from greater Minnesota that we try to capture at Minnesota Compass as well. And then we shape policies we help shape policies for the greatest reach and impact, and try to maintain an informed public. So thank you all for engaging today. So on Minnesota Compass, we provide unbiased and credible information. We track trends and measure progress on issues in Minnesota's community that impact our shared quality of life. And then we identify disparities by including trend data by race, age, gender, and income whenever possible. And then we also know that data doesn't do everything, right? We can't just hand people data and expect change to happen. So we provide additional resources for addressing issues as well. And then this is a number of the collaborations and foundations that support Minnesota Compass's work. And they provide funding so that we make sure that this is a free resource for anyone in Minnesota to use. All right, so I'm going to talk a little bit more about who lives in Minnesota right now. So right now we have 5.7 million people living in Minnesota. A little bit more than half, 55% of Minnesota residents live in the Twin Cities 7-county metro area, and for the rest of the 45 live in greater Minnesota.
Hi, do you know the percentage for just Ramsey plus Hennepin?
I don't off the top of my head, but later in the presentation, I'll do our build your own tool where we can do that question and highlight that answer. Thank you for that question though.
Annie, quick question. Do you know the other urban areas versus rural? In other words, if you put together Duluth and Rochester, the big urban sites that are also urban.
Mm-hmm. Like what percentage of that population?
Right, because there's rural.
Right.
And there's non-Twin Cities.
Yes, that is an excellent question as well. I don't know it off the top of my head, but that is a question that we can definitely dive into as well. All right, so we have 1.25 million Minnesotans aged 65 and plus by 2033. So age trends are transforming Minnesota. The number of Minnesotans aged 65 and older is projected to increase nearly 300,000 people to 1.25 million, which will make up about a fifth of our state by 2033. So these are impactful numbers, right? a fifth of our state will be age 65 and plus, which has a lot of implications for healthcare, for employment, for service provision. So right now, this is where we're at. We have 48 counties where at least 20% of the resident population are age 65 and plus. So we see concentrations in northern Minnesota, some parts of western Minnesota, less so in the metro areas. By 2033, these darker shades mean that we're going to have more residents that are age 65 and older. So we jump from 48 counties to 76 counties where at least 1 in 5 residents are age 65 and plus. We see more concentrations in northern Minnesota here, some parts of southern Minnesota, and also, again, less so in the metro here. By 2053, this jumps a little down to 62 counties. But, we start seeing more of these darker shades. More than 1/4 of the population is going to be 65 and plus. So in the Twin Cities metro region and throughout the state, we're getting older. Our workforce and economy is becoming more diverse, especially among our youth population. So I'm going to talk a little bit more about this now. So who else lives in Minnesota? Residents of color. So residents of color comprise of 22% of Minnesota's total population. In the Twin Cities, 29% of the total population are residents of color. And this varies a little bit by age, where we see that nearly a little bit more than a third of our state's youngest residents, 0 to 4, are residents of color, compared to just 7% of those who are 65 and older. And I have a chart here to show a little bit more about that. So this is specifically in the Twin Cities metro here. We see that our 65 and older population, or older populations, are made up a little bit less of people of color compared to those, say, 0 to 19 here. So a larger share of youth are people of color compared to older adults. So that's just kind of a taste of what we're doing on Minnesota Compass. We also have a number of quality of life indicators, so looking at indicators such as arts and culture, education, the environment, housing, workforce. We track and trend a lot of indicators so that we can get a broader picture, but also a more complete picture of what life is like in Minnesota for people, specifically by some of these breakouts that I talked about earlier, such as age, demographics, income levels. And then we also provide insight and analysis. We provide data updates when they come out regularly, and we try to provide analysis on those as well. We write insights articles, so that's where our research scientists, our research associates dive into the data a bit, and then we can we distill a little bit about what we're seeing and what this could mean for Minnesota. We do podcasts. I don't do podcasts, but we have other people who do podcasts. We compile stories and maps from people who use our data in the community. We have a Compass quiz so that if you like things that I did earlier before to challenge you to think about, largest populations in Minnesota, we do Compass quizzes. And then we provide a number of resources. We do events and webinars. We have a racial equity resource directory where if people are really interested in getting more engaged about racial equity, there's a number of programs that we have in our directory database that you can search for and get more information about. And then our most recent directory is this leadership program directory where we collect leadership programs from across the state and make sure that we are inclusive of different types of leadership, leadership for different populations, so that anyone who wants to become a leader can make sure that they're getting into the correct leadership programs. And then we also have a short 2-page brochure, what we call Compass Points, which compiles annual data updates for 2022. So those are all on our website. Okay. Any questions? All right, so I'm going to dive a little bit into the state and metro area data estimates for 2016 to 2020. These are the most recent American Community Data Survey estimates. And so this provides a broad level of information on these topics here, all of which can be found on Minnesota Compass's website. But today we're going to specifically talk about a few of them, specifically. Am I still talking? Okay. Specifically related to health, housing, and this workforce development topics.
Annie? Oh,
What are you defining as the metro?
Oh, yeah. Can you repeat your question one more time for the folks online?
What are you defining as the metro? You said metro level, so how are you defining metro? The 7-county area, the SMSS area, the...
Yeah, thank you. Thanks for asking that question. So the question again was, what are we defining as the metro area? And so it is the 7-county metro area that we include in our definition of the Twin Cities metro. Yes,
and
Ken?
Annie, what is the adult community service study Yeah, I'm talking. Yeah, what's the adult? Is it adult?
Oh, sorry. This is the American Community
American.
Survey. Yes, so
And-
it is a product of the census, and this is an annual survey that samples a portion of the population, but then is compiled by really smart people into really accurate estimates that predict at our levels of geography. So for our purposes, we usually get it at the state, the county, the city, and I think we can get it at the zip code level as well.
So we all have been a part of that data then.
So you may have very well been sent the American Community Survey. I don't believe that it goes out to every single person, but it does go out to a number of people, and then those are changed into estimates for us. Great question. All right, so this first area that we're going to talk about is race and ethnicity. And so I have both charts, data tables, and data charts for you. So when we see a data table, it is a statewide look. And then when we have data graphs, those are going to be at the metro area here. So statewide, we see that about 80% of the population is white, with about 18% people of color. And this can be broken down. For statewide, we see that the largest population of people of color are Asian or Pacific Islander alone. Oh, sorry, Black or African American, and Asian Pacific Islander alone second. This is something really cool that one of my colleagues compiled here, and it's something new that the census had released this year, and it's called the Minnesota Diversity Index. So what is the probability that two people selected at random would be different from different racial or ethnic groups? So this is on the left from 2010, and this is on the right from 2020. With darker shades, meaning that there's a higher probability that two randomly selected people will be from different racial or ethnic groups. So much more color here, much more darker colors here on the right. In Hennepin County in 2010, we had about 50% diversity index, meaning that there was a 1 in 2 chance that two people selected at random were going to be from different racial and ethnic groups, which jumped to 54% in 2020. In Ramsey County, we had 55% in 2010, and that jumped to 61% in 2020. So we have much more diversity in the Twin Cities metro and across the state as well.
Can you explain, say what those dark gray counties are, please? Just so I get my bearings on.
I'm not that familiar with the county, like which shape those counties are. Does anybody else? So yeah, these ones here, these are Ramsey or Hennepin and Ramsey County. I'm not sure what the state is. Does anybody? Yeah.
Okay.
But I can definitely get back to you on that. Yes. Yes. Right, Ramsey is at 61% here. All right. So I'm going to talk a little bit about language needs. So in Minnesota, we have about 88% of the population who only speak English. We have about 12% of the population that speak another language other than English. And we have about 5% that speak English less than very well. You're welcome. All right, in the Twin Cities metro, we see that Spanish is the most popular, is the most common non-English language spoken at home. Does that surprise anyone? No, okay. So we have Spanish, Hmong, Somali, and Vietnamese falling fourth here. So those are the top languages other than English spoken at home in the Twin Cities metro right now. All right, nativity. So foreign-born residents. Statewide, we have about 8% of the population who are foreign-born. In the Twin Cities metro, we have 12.3% of the residents who are foreign-born, which is slightly less than the US average of 13.6%. And then this chart here is for the Twin Cities metro. We see that more than 1 in 4 children in the Twin Cities metro has at least one foreign-born parent. So less so in these older age groups and more so in these younger age groups. This yellow is Native children with foreign-born parents, and then a smaller portion here are foreign-born residents. And this shapes the projections of what kinds of services and needs, what our workforce will look like as they age. All right, I'm going to talk about income and poverty. So in income and poverty, we have about 1 in 5 households that are making less than $35,000. A little bit more than a third are making more than $100,000, and the state median income is $73,000. So we have about a fifth of the state who are making less than half of the household median income for 2020. We have about 9% of the population statewide that have an income below the federal poverty level. And then with some of our measures, we're able to do some crosstabs, so we're able to also look at income and age. So we see that a slightly larger share, this 19%, 18 to 24, this younger working age population, about 1 in 5 have incomes below the poverty level. And our smaller shares are some of these older adult populations here. Yes, so the question was, what is the federal poverty level? And I believe that we'll look this up, for a family of 1, I believe it's like 12,000. And then I think that can range, it has a range of depending on how many people are in that household. Oh, sorry.
Do you know of the percentages you have up there, like 18 to 24, that age range? Are those people living with parents, or is this by themselves, or?
Yeah, that's
Do we not know that? Or?
That's an excellent question. So are these 18 to 24-year-olds those who are living alone or living with other family members? It's a great question. I don't believe we have that data on our website, but I think that is something that we could probably look into. The American Community Survey looks at, status of like where you're living. So are you living with other people? Are you living alone? And so that's something that we don't have cross-tabbed yet, but that would be something really interesting to look into.
I have the federal poverty level.
Yes.
For a household of 1, it's 27,000.
27,000.
For a household of 4, it's 55,000.
Okay, thank you. Thanks for looking that up.
I think you got the numbers multiplied. For a family of 4, at least what I'm looking at, it's $27,750. they had a column if you multiplied to 200%. And for a family of 3, it's 23. And 1, I don't know what it is. But for a family of 4, it's $27,750. And I will add that calculation. I'm going to grab a number out of the sky, but that was actually done, I think, in the 1980s. And there's been political, nobody's willing to update that.
Thank you. Yeah, thanks for looking that up. So on our site, we also do have, not for all of our breakdowns, but at least in this chart, we have those who have an income between 100 and 149% of that federal poverty level. So it kind of breaks it down a little bit more so that there's a little bit more in between the two numbers. All right, so this is a chart for the Twin Cities Metro, so individuals below the poverty level by racial and ethnic group. American Indian and Black residents have the highest poverty rates among all racial and ethnic groups, while non-Hispanic white residents have the lowest here. So about 5% of white non-Hispanic residents in the Twin Cities have an income below poverty level compared to American Indian and Black residents between 1 in 4, and about a little bit more than a third of American Indian residents. All right, so next I'm going to talk about healthcare coverage. On our site, we have healthcare coverage. We look at those who are insured and those who are not insured. So for those 65 under, for whom health insurance coverage status is determined, we have 85% of the population being covered by health insurance, and we have about 5% who do not have healthcare insurance. I heard that's not too bad. That looks better. Yeah. So I'm going to show you this next chart of the Twin Cities Metro here.
Annie, before you go on,
yeah.
what they're missing percentages there? Is that the elderly or?
Yeah, so this is 65 and under.
Okay, still it adds up to 90.
Oh, yes.
Is that Medicaid? No.
Yeah, so Medicare, Medicaid, I don't believe it's covered there.
Yeah, okay.
Yeah.
Be interesting to know what that gap is. I don't think it's Medicaid, but go ahead.
Yeah, thank you. So this is the Twin Cities metro area here, and we see that a smaller share of non-Hispanic white residents lack health insurance compared to these other racial and ethnic categories, such as Asian, Black, non-Hispanic, and those who do not identify with any of the census race categories. Yeah, so we see that those of other races, about 20%, 1 in 5, do not have health insurance, compared to just 3% of white non-Hispanic residents here.
Do you mean that the other race category is people who are not Asian, not Black, not Hispanic, not white?
Yeah, so there's definitely a lot of other categories who don't fall between these, and so they might identify as another race.
And that's the biggest category.
Mm-hmm. Yes.
Annie, do you know if this covers not undocumented aliens? This is people per se?
So the American Community Survey is just like the census, and so I don't believe that they ask about, documentation at all. So we're not sure, but it could definitely be. All right, next I'm going to talk about housing. So we look at housing in terms of cost burden households. We also look at it in terms of home ownership. So for cost burden households, what does that mean? So if you are paying more than 30% of your income for housing, you are a cost burden household. So we have about 25% of the state paying way too much for housing. They're paying more than 30% of their income for housing. And this varies by if you own your home or if you rent your home, right? So if we look at this renter household for which cost burden is calculated, a little less than half are cost burden, versus if you own your home, just 18% are cost burden. The average rent we see in Minnesota is about $1,000. And then we're going to look at a little bit at the Twin Cities level here. A smaller share of Asian and white non-Hispanic residents are cost burden compared to American Indian and Black residents here. All right, now we're gonna dive into a little bit about this home ownership rate. So we see that 75% of white non-Hispanic householders they have the highest rate of home ownership compared to all other racial and ethnic groups. Particularly Black residents here, only 1 in 4 residents are homeowners. And then this last area that I'm going to talk about is workforce. So what does our workforce in Minnesota look like? So we have 81% of the working age population are employed. And then unemployment, we have about almost at 4% here. Education levels by those who are working, we have 93% of the population having greater than a high school degree. We have a pretty educated, some college and bachelor's degree or higher, coming at about 50% of the workforce here. We also look at high school students graduating on time by racial and ethnic group. So the portion here where we said 93% of the population has a high school degree or higher, who's graduating on time, right? So we have a larger share of Asian and white non-Hispanic students are more likely to graduate on time compared to all of the other racial and ethnic groups here. And then just back to a little bit about who is working. We do have we are able to capture some information about those who are foreign born. And we see that a slightly smaller share of foreign born residents are working compared to native born residents, although the gap has narrowed in recent years. So 77% of foreign born residents are working compared to 80% of the native born population. So we see that as a pretty similar rate there. So I just spit a lot of data all at you. What does this mean for Minnesota? So in terms of housing, healthcare, workforce, service delivery, Minnesotans are aging, right? We see more residents who are age 65 and older, and that's projected to keep growing. We also have a number of aging foreign-born residents. And then secondly, Minnesotans are more racially and ethnically diverse, and they're going to continue being racially and ethnically diverse. Our youth are more likely to be residents of color, and then we have a portion of residents that are non-speaking, and then the disparities that I've shown you through the different breakdowns are stark, right? We see a lot of people of color not having the same opportunities, not having the same outcomes as some of the other groups here. All right, any questions so far?
On this particular slide, you're comparing Minnesota to Minnesota, right?
Minnesota to Minnesota.
Well, you say Minnesotans are more racially and ethnically diverse.
Mm-hmm. Yes, so
you're
talking
comparing Minnesota of the past to Minnesota of the present.
So what I'm talking about, yes, is Minnesota is becoming more racially and ethnically diverse. Minnesota is becoming more aging. Right, yes. We're talking about Minnesota Compass, and so, yeah. Thank you for that clarification.
I had a couple questions or comments. The one that was about having a foreign-born parent was quite striking for children, and then there was a complete gap in the middle working, and then there wasn't any up top for the aging population. But I just wonder what that data would have looked like 100 years ago, say.
Right.
Because it seems like we're just sort of going through a similar cycle in that. Do you have historical data to compare to that?
Yeah, I mean, there is historical data. I don't remember when the census started collecting more information about foreign born. So I think it would definitely depend. There's different, every year, like they introduce different questions. So I think it would depend on how long ago that was first introduced. But I don't know if we do anything that historic. But I think that would be a great insights article to look into. You know, there's different waves of immigration into Minnesota. And that's definitely very interesting when it comes to seeing charts like that, when we see this gap.
And then my other question is, when it says white parentheses non-Hispanic, is that how it's listed on the survey that people complete? So that if you're white but non-Asian, that's not a category.
Yeah, so Hispanic is an ethnicity, and so that's a separate category that people can check. So in that ethnicity category, you're either Hispanic or non-Hispanic. And those are kind of the two options that you float in between. Yeah, so yeah, on the census is listed as white non-Hispanic.
So you're saying the only two ethnicities are white and Hispanic?
Hispanic and non-Hispanic.
Non-Hispanic.
So you're either from a Hispanic country or Hispanic, Spanish-speaking area, or you're not.
Isn't that, I'm not a data person,
Yeah.
but that seems sort of interesting that you don't consider other ethnicities non-white.
Yeah. So I mean, there are also, you know, there's also a fill in your own response. So like if these don't respond to you, like you can also fill in your own. And then there's also like 2 or more categories, but we don't necessarily always get more information about which 2 categories those are from. Yeah.
Annie, I don't know if I'm right on this, but what I think is you have Hispanic, you have Native American, African American, et cetera, and then white is always white non-Hispanic, which is odd because, and I think it comes from the fact that for a while Hispanics were grouped with white as opposed to black as opposed to Asian. So I think that white non-Hispanic is what we normally sitting in this room think of as white. But there was a period when Hispanic was rolled into white, and so they had to pull that out.
Thank you. Yeah.
I may be wrong, but that's how I think this evolved.
Yeah. A question in the back.
Yeah, from online, there's a question about information about disabilities. Just wondering if you have that and.
Yes. Not in this presentation, but yes, there are, we do have disability data when we can break it down by those who are disabled and those who are non-disabled. Other questions? This is not the end of my presentation, but I do want to pause for questions.
Try this.
I was wondering if the American Indian was getting more support
Yeah, by support, do you mean like?
with health care, education.
Yeah, I know that they're, so I don't think that's anything that we necessarily track. But in terms of, you know, some of these outcome measures that we're looking at, we can look at it over time. And I think that's, you know, partly what our additional resources can provide is, you know, we can provide this data, but who's going to work on this work? Who's going to, you know, commit the resources and the time to do it? And so I think that's kind of where this data is actionable, is that, you know, if you are seeing these disparities, if you're seeing these outcomes as being not equal, that's something that is actionable and people can continue to work on these areas. So hopefully over time we can see that growth and see if any of the changes are working. Yeah. Questions for you? No. Oh, okay. Sorry. You looked like you had a question. So this next section, I'm going to do a quick tutorial on this Build Your Own tool, which allows you to customize profiles for the geographies that are most important to you. You're able to select from predefined geographical boundaries such as counties, regions, districts, municipalities, and even neighborhoods. You can combine several areas to aggregate demographic and socioeconomic data. And then you can also compare demographic and socio-demographic data between one geography and another. And you can also draw a custom geography boundary to produce an individually tailored profile. So I'm going to walk you through a little bit about what that looks like. All right, so this is our Minnesota Compass website, and it is newly revamped as of last year, so hopefully it's easier on the eyes for you all. This is our About section, a little bit more about our project, the data, how to use the data, different stories of people who have used the data and have seen the impact, the staff advisors and our partners. And then this is, the bulk of our website is exploring the data here. So we have them grouped into who lives in Minnesota, where they live, different quality of life measures, and then our special projects here. So we have a section on COVID-19 data, who leads in Minnesota, so leadership information, early childhood information, STEM in Minnesota. And so these are all different areas that our partners have identified are a great source of need for data, and so that's why we have special projects in these topic areas. And then we have our insights articles where we talk a little bit about, say, if you want to know more about disability and employment in Minnesota, we dive into the data for you all so that we can distill it into an article. Try to publish these once a month. And then, sorry, just trying to find our build your own tool here. Okay, so it lives under where they live, and this is build your own custom profile. So this is our build your own tool here. And so we had some questions about what's the population that lives in Ramsey and Hennepin County earlier. And so that's a question that I can take and dive into. But just a brief overview of this mapping tool here. So these are the counties here. Outlined, and then you can also just zoom into the Twin Cities metro here as well.
Annie, before you go on, can you go back to the prior?
Yes.
No, the prior, the state one that had the counties.
Oh, yes,
what
sorry.
was
Yep.
the bill?
Okay, I see what you're saying. The state.
Can you put your pointer and tell us what that county is?
Yes.
That's the
So
one
this
that-
is the one that we saw earlier here. This is Monoman County.
What is it again?
Monoman County?
No, 'cause
Yeah.
It's got a ton of diversity.
Mm-hmm. Yes.
Can you tell us why? Do you know? And I realize
Yeah, let's look at the profile for Monoman here. So if you are just interested in Monoman County here, we look at the population, the age, sex, and then the racial and ethnic. So we have more than half of the population are people of color, and we can dive into about a third here. Are American Indian or Alaska Native alone. We can look at their quality of life, such as disability, income.
What's their insurance rate on the dock?
Yeah. So we have 17 or 18% here do not have health insurance.
As opposed to the 4.3% that we had statewide.
Statewide, yeah. So, in addition,
My microphone wasn't working, so I'll just say again. And I was interested in Winona County and the insurance rate. The lack of insurance rate is 18% versus the 4.3 for the state,
yes,
and it's Native American.
yeah,
Of course, now there's a question, interestingly, Native Americans are covered under the Bureau of Indian Affairs.
mm-hmm.
So they may, in fact, have
Yes,
access to
yeah.
health care.
Right. Yeah.
Okay, go ahead.
Thank
Sorry.
you. So again, if you're interested in counties, that's great. But then we also have different geographies that you can look at statewide. So if we're looking at specifically, sorry, I actually also want to just respond quick to the Hennepin and Ramsey County profiles. So when we look at the population here, so this combines the Hennepin and Ramsey when we click on 2 here. And this population in 2020 is about 1.8 million here. And I'm going to start over because I think a really cool piece of this is being able to find different geographies which we don't typically see data for. So if we're interested in, say, the Minnesota Initiative Foundation region, so Northwest, Northland, West Central, Central, North, or Southwest, and Southern, and the Twin Cities, if we were just curious about southern Minnesota, we can look at a profile for that, and that this automatically compiles all the data that we have for it. So it's many of the similar categories that I talked about today, plus more. And then with each of these, we have margins of error, which help us predict, how close we are to the actual number here. And then one other great thing I love about this build your own tool is that we can draw a geography. So say that I'm going to put back on our state. Actually, I'm going to do census tract. So these are census tracts, very fine geographies. But say that we are very interested in, so I'm from St. Paul, or I live in St. Paul right now. And so if I was interested in my neighborhood here, I could draw a neighborhood boundary. And I believe that it has, you need to be within, I believe, more than 500 people in this geography. But I'm going to click on this draw a polygon tool, which will allow me to draw any random shape here that I want. And so say I'm interested in something that's north of 94, but maybe south of Marydale Park here. So say that you're providing services to this area. We can, double click to be done. Sorry, this is hard on a laptop. But I'm going to view the profile here. Ooh. There we go. We have a box here. And I'm just going to view this profile. And it might take a second because it does all of this in live time here. But we see that, 52,000 people live in this stretch, and then we can see a little bit more about the same data topics that we had talked about earlier as well. So this is a great tool so that if you're specifically interested in a neighborhood or a particular geography that you have, this is something that you can use to approximate all of the data that we had. Yeah.
Annie, we have about 10 minutes left.
Yes.
So I didn't know if there was something
Yeah, I just
specific you want to leave us with.
Yeah, thanks for the time check, Ken. So that was our build your own tool. I'm gonna go back to the presentation. Of course, it doesn't take us through the whole thing. There we go. So that was your build your own custom data profile tool. And then if you're itching for more data that we don't have on our website, we do have a link to a number of other data resources. So we get our data primarily from the American Community Survey because they provide a wide breadth of indicators, but we also work in collaboration with other data resources to get other data that we're interested in. But these are also additional on top of the additional resources that we have on our site. So these are sites for more information about housing and more about healthcare and health, and then workforce development. So you can go to any of these sites, and then there's going to be much more data for you to look into as well. And then I have some discussion questions. I don't know if we have time for that or not. But any other questions or things that we'd like to talk about? Yeah.
Two things. Do you have resources if,
Mhm.
let's say, our housing group wanted to get some help, wanted to get a better picture using this data? Do you have
Yeah.
resources like you or someone who can help when it doesn't come out quite the way we want it, which is fairly common?
Yeah. You can definitely feel free to email us, and then we can help you find the right resource or get the geography right for you.
And then can you give us one short story
Mhm.
about something that someone came to you and somehow the data got used
Yeah.
actionably?
Yeah, that's a great question. So one of our trying to think of one organization. So there is a service provider in southeast Minnesota called SEMCAC, and they were really interested in some of their service area because they do a lot of work in that area, providing direct service. So they were looking to learn more about that geography, who lives there, what languages they're speaking, so that they can make sure that they have translators on site, and then see, like who's most in need in that area. And so by learning a little bit more about that geography and who lives there, they're able to more succinctly provide services, and provide more appropriate services, right? Like if you are providing young adult services for a population that is pretty old, like that's not going to be a great match. So they can tweak their services and understand a little bit more about who lives there.
So do we have questions in the room and any questions online? Not yet. Ask away. You go ahead. This one is? They automatically turn on.
Does Minnesota Compass have a comparable in other states?
That's a really good question. There are a few states that do this, but we are one of the few that do this for the state for as long as we've done it for.
Okay.
Some states are newer, some states don't cover as much. So this is truly a really great resource for the state, because primarily we provide it for free, and we've been able to do this, and we've been able to make and curate it so that it is most useful for our users.
My other comment or question is, okay, so we're a community of faith, and what do we as a community do with this resource? And I just had this idea that I get the weekly faith and values plug, and I thought, well, wouldn't it be great if every week there was a different data thing provided in the faith and values, just so we as a community be growing in our awareness via scientific data,
Right.
To be more acutely aware of what this all is,
Yeah, and I know that we have monthly newsletters that go out as well that have a lot of this data as well. And I know that for your community, like I know that there's probably a lot of intersections, right? You are not all one type of person, and so I think different data can call out to different groups of people as well. So I think that's a great,
Thank you.
great comment as well. Yes.
I think we're going to need to come to the end.
Okay.
So, so thank you, Annie.
Yes, thank you all for
Great.
being here.
Overwhelming amount of data, but I got to tell you, having been a data person, I've used this, and it really gives you power. It's just amazing. Before I talk about next week and the week after, there has been formed a work group on reimagining community safety. So the whole issue of the police issues and all the stuff that's gone on, especially since George Floyd. That group is, well, if you're interested, you're supposed to contact the ACT at wpc-minneapolis.org, which I think gets to our website and then a subsection of this. We're going to be hearing more about it. There was an article in the newsletter, but it's a big deal. The church has done 5 position papers where they've said, we've studied this and we come down on the side of justice, meaning this. The most recent one was mass incarceration. It's a year-long project. So it's a powerful thing, and if you want to participate, you'll learn a ton, and this is obviously very important to our state and the whole nation. Next Sunday is the Fair Trade, so that'll be scattered all around. There won't be social justice. I think there won't be Adult Ed either, but I'm not going to speak to that. The week after, Ed Ellinger, who was the Commissioner for Public Health and is now in a brain trust at the U, an interesting fellow, amazing career, done a lot of work on the social determinants of health. So that's it for today. Thank you for being here. Yeah. Thank you.
Thank you.